most important thing for everybody to kind of take away from today's, meeting is that anybody can refer. So everybody in this room has the power to refer an individual into enhanced care management or community supports, which is actually on the next slide, so I'll just go there. And so that's kind of memorialized here is that anybody, a member themselves can also refer in. So that's really important for y'all to be aware of. I also will say with like enhanced care management, there's a lot of complexities, or it may look like, does this member meet the criteria? Most likely, given the population that you all serve, there's a high probability that they meet kind of the threshold with a level of like clinical and social complexity. So if you think a member is, you're kind of like, I think this member qualifies, but I'm not sure, just refer them in, because in addition to enhanced care management, managed care plans also have a different levels of case management support that they can provide. And so what we really want to do is get them connected with the managed care plan and really help to identify where do we, if an ECM is not the right place for them, where else within the benefits and things that are eligible to them that we can connect them to. So as I mentioned, anybody in this room can refer. You can also empower the folks that you're working with. They can also refer in. And there's a few different mechanisms. So we have a referral form. As we mentioned in Sacramento, it's really fantastic that there is a joint referral form, because often what we say is we'll accept any managed care plan's referral form. The caveat is that you have to remember where to send that form. So you could have a Kaiser one, but you have to remember where's the email or the fax that I can send it to. So I know we're working on developing a community supports one to really help streamline this process and make it even easier for you all, so you don't have to manage so much stuff in your head as you're working with a member. So basically, you would take that referral form, you can send it to should be Kelly Referrals at anthem.com, or you can send it via fax. You can also, if you're working with a member, you can always, you and the member can call our customer care line and they can help get you connected and enrolled into ECM or CS. And then we also have Find Help, which is another option. And we usually recommend this option if you're not contracted with Anthem to provide the services yourself, but you want to enroll somebody. It's a really good way for you all to kind of track the status of that referral. Regardless, you'll be able to kind of get the status update on where the member was ultimately placed, whether they were assigned to somebody or if they were declined services. But we always recommend that as another easy option, just because you can submit it right there online. So this goes a little bit more into how that community resource link is kind of made available to you all. So we have our kind of proprietary Anthem kind of login space and platform. You all would just enter in kind of the corresponding zip code, and it will show everybody who's providing services within Sacramento County for the given service that you're interested in. So for instance, right here, if you're looking at, I think this is on recruitment of care, so a little bit outside of what we're talking about right now. But essentially the process to refer an individual in, you basically would click on the recruitment of care, and then it's basically all the information that's in our current referral form is just available on this kind of online platform. And you just go ahead and submit it in. If there's any additional requested documentation, you can always provide it there. But our team will always also work with you if we're missing documentation, because the goal is really to get members connected to services. So as I mentioned, you find the service that you want, you'll click apply here, you'll fill out the information that's required, and then once that's submitted, you'll receive updates on the status of your referral once services have been rendered. Here is our kind of cheat sheet on really kind of how, really is a little bit of a duplication of what I went through previously, but it just has a side-by-side comparison of ECM and CS with additionally our referral forms attached. So these ones are actually our Anthem specific ones, but again, for folks here in the room for enhanced care management, we really encourage leveraging the Sacramento kind of joint referral form, so you don't have to kind of remember where to send it. And then also here's the information on the secure email, fax, and then the find help. And then obviously for our providers that are in the room, again, we really encourage you all to leverage your provider portal, as I'm sure you've heard us mention numerous times, just to really expedite that process. I will say typically our turnaround time is supposed to be within 3 to 5 days to get a response. ECM is a little bit different because we have what's called streamlined authorization, which really allows providers to start working with members then and there for up to 30 days and receive payment, provided that they're not already getting services with another provider. So really it's intended to kind of better connect you all to service or get members connected to services as soon as possible. So I think that's it, but one of the things I would definitely recommend is for everybody in the room, like as you're networking, just identify if you are already a contracted provider, whether for ECM, CS, so you all kind of have like in the back pocket who I can call, especially on the ECM side or community supports, because it really is about those relationships and developing those warm handoffs as you're connecting members to services.
All right. Hi everyone. Again, I'm Tiana Wu. I'm with HealthNet, overseeing Cali implementation in the county. So Alana lifted up a lot of really, important points around kind of no wrong door approach. We accept one another's forms, although the universal form that Transform Health co-developed with us is probably the easiest, most streamlined way to make referrals. So just kind of underscoring that again. And I think, one other thing, I'm not sure if it's in my slides, but I think Warren's messaging, we're speaking here, and maybe it'll be in your slides, Christina, I'm not sure. We're speaking here about enhanced care management and community supports. But community health worker benefits are also available to members. So, as Stephanie had described when she was walking through some of the earlier slides, enhanced care management is, or I guess it was Naomi, I'm sorry. Enhanced care management is really intended to have that high touch care coordination for our most vulnerable members that are in need. And so based on kind of their eligibility to that service, if they're found not to be eligible for that service, meaning they don't kind of meet that degree of high need, there are community health worker benefit services available, and essentially that's kind of considered a step down level of care where folks can still get that one-on-one support in coordinating and getting access to services in the community that's not quite as high touch. So I just wanted to make you all aware that that's also a benefit that's covered from the managed care plans for free for our shared community members. So I think, the referral processes across all plans tend to be quite similar. But slightly different methods of making those referrals. So on this slide here, this is HealthNet's ECM referral process. We have the QR codes that link to some of the resources available. I'm going to go on this side for a moment. So we have 5 different ways that you can make an ECM referral. This number 1 right here, unless you're a contracted provider with HealthNet, just ignore this. This is strictly for our contracted providers. If you're if you're a referral partner in the community wanting to make an ECM referral, the steps, or I guess options 2 through 5 are the best ways to do that. So as Anthem shared, Find Help is a platform that we too have, almost like an online yellow pages or directory of sorts of all of the community resources, not just community supports resources available in Sacramento, but it is more expansive than that. So it's a great resource kind of for all things social services. So you can find our link to Find Help. It is a unique hyperlink, so different than Anthem's, essentially the same services in there. And you can log in, create an account, and make an ECM referral right there. And then you can also use our provider directory, which is essentially like a phone book where it, links by zip code. Each one of our providers, given the population of focus that they have and that they're serving, and you can just make a phone call to that provider right in there for that referral. Additionally, you're able to call our member services phone number and get support directly through HealthNet to make that referral. And then finally, we have the fax option, kind of old school way, that you can use a template and then submit via fax. And then for community supports, again, kind of flow chart as to how you can there's two different methods of referral pathways for community supports. So first you have to verify the member eligibility for a given support, and so that goes back to the slides that Naomi was presenting on earlier that kind of outlined every one of our 14 community supports. I find it as a helpful toolkit. I actually have it like bookmarked in my computer because it says you may be eligible for this service if, and it gives examples. So it's a great way to like quickly have eligibility criteria at your fingertips, while you're working with the member in real time. So you verify their eligibility, and then verify they qualify for CS authorization guides. So those might be in the appendix. Naomi, do you remember? I don't know if I linked all the auth guides. If not, I'll follow up. So that's again another really great service, set of resources where by each one of the community supports, it is a guide that outlines kind of what the community support is, what the eligibility criteria is, even billing codes if you need that. So it provides a really comprehensive kind of one-page resource for each one of the supports. And then, if all of that is verified, you can make the referral. It's always recommended to go through Find Help because it's a single-stop shop. Or you can do the provider directory that I had just stepped through in the previous slide. So we also have our community supports providers by zip code, by service in that directory. And that's it. So I will yield to KP.
Hi everyone, again, my name is Christina Pena with Kaiser Permanente. I'm part of the local engagement team and I support Sacramento County. I also live in Sacramento County, but I support a total of 5 counties in this role: Sacramento, El Dorado, Placer, Yuba, and Sutter. And really meant to be that bridge or that liaison between our community partners and county, all to support our CalAIM effort. So work closely with our managed care plan partners and Transform Health and a number of different stakeholders to move our goals forward. Let's move on. So I'm going to give you kind of a similar spiel and add some extra details as well. Before jumping into this, just to add some extra context, Kaiser Permanente is in 32 counties in California. That includes all the neighboring counties in Sacramento. So if you're working with individuals or families that are transient or moving between counties, good to know that Kaiser supports those additional counties for continuity of care as that individual may be moving between counties. Really quickly, this kind of piggybacks off of some of the supports with the managed care plans. Beyond Kaiser, Anthem, and HealthNet also support, as we think of complex care management, I'm pretty sure all the managed care plans support that. But before going into this, just in purple, really quick, there's a lot on the slide. In purple, you'll see the enhanced care management, community support, and that community health worker support. This is in purple just to denote that this is provided by our community-based providers in the community. Again, the managed care plans contract with community-based providers that have that experience in a particular population or area of focus, and also often have staff with lived experience. So they really can meet the member where they're at and connect and build that trust and support them as they provide that enhanced care management or community supports or community health worker supports. In blue, these are just kind of some additional layers of supports that the managed care plans offer. In the case of Kaiser, we provide a complex care management support. This is kind of meant to be primary telephonic care coordination. It's meant for individuals with chronic conditions or specific disease needs, specific disease-related case management needs. It's kind of meant to be more short-term, but if you think of kind of care management in terms of like high, medium, and low, I would on the slide too. Enhanced care management, where again is that highest in-person intensive case management tied to individuals who meet the population of focus, those 9 populations of focus. Complex care management, open to all Medi-Cal members, not tied to the populations of focus, but that middle grade that's available, that's offered by the plan, by Kaiser. And then lowest tier light touch would be that community health worker. Again, you don't need to be tied to a population of focus, but if you're working with individuals or families, a family member might be eligible for community health worker supports. And it might be valuable to leave them to help navigate their care and services. Really quick, I don't want to leave anything out. Something I like to leave as a takeaway, and this is kind of something that we're stressing, is, again, we don't want all this complexity to hold you up. If you're working with an individual or a family or a group of individuals that you think would benefit from one of these services, call, make that that referral. We will do our due diligence to assess where that individual might fit in levels of care. And often, enhanced care management is that gateway to connect and link an individual with their health needs and their community-based or kind of non-health needs support. So oftentimes if you're like, I don't know what community supports are gonna work, but I do know enhanced care management would be really beneficial, then that would be your primary stop, and that ECM and enhanced care management support will do that extra due diligence with connecting that individual to their needs. Right here. So again, want to stress Sacramento is really unique. We have that shared joint referral form, which I believe we're gonna mention this later in the presentation, but because we're in so many counties and all the plans have their own unique process, Kaiser too has its own referral forms. We have 3 specific referral forms. There are live links here in the slide deck, so when you have it, it should take you straight to the referral form. Each referral form will also give you kind of like a cheat sheet summary of what is part of the eligibility. So if you're questioning, there's guidance in those referral forms for you to refer to, just to make sure, okay, is this individual going to meet eligibility? The first referral form I like to think of as that referral form for case management or navigation. It's meant to offer kind of 3 potential services you can link an individual to: enhanced care management, that middle grade complex case management, or community health worker supports. So if you're like, this individual needs support with managing their care, navigation, that's your form, the first one. The next 2 are tied to our community supports. The second one is tied to making referrals for any services that support an individual with housing insecurity, so there's housing trio, as well as, actually I know this by heart, and short-term post, short-term post, why am I forgetting? Hospitalization, thank you. And I don't want to break down acronyms, I'm trying not to do that, but yes, the housing trio, day hab, recoup, and short-term post-hospitalization, thank you. So those services are all available for you to make that referral through the second referral form, and then that third referral form is grouped for any services for ED members at home, so home modifications, for example, or addressing any chronic conditions like medically tailored meal or asthma remediation. And then for Kaiser Permanente, we break up our referral process into 2 categories: Northern California and Southern California. For us up here in Northern California, you're going to use the right-hand column. Again, you can make a phone call to our representative with the member or without. You can also fill out that referral form and submit it by email. Again, anyone can make a referral, a provider, the individual themselves, a family member, a neighbor, again, open-ended. And I can't stress enough, if you think a person would benefit and meets eligibility, please make that referral, even if you're not sure if you have all the information. Here's a quick snapshot of our timeline for our ECM referrals. Ultimately, from referral to connecting an individual to an ECM provider to start services, it's about a 2-week window. So starting over here, again, you make that initial referral, no wrong door. We collect that referral. Kaiser Permanente on the plan level does that eligibility assessment. Again, assessing is it ECM or is there another support we can link that individual to. That takes about 2 to 6 days. From there, once an individual is deemed eligible for ECM services, Kaiser Permanente sends that information to one of our network lead entities, and they're an entity that supports our provider network. So they will do the outreach. It's really important, if you have a trusting relationship with the individual, let them know to expect a call. This is really helpful, or to expect communication from an organization about enhanced care management. We do need the individual to consent, and this is part of that outreach, just to make sure, like, are you ready to enroll? We're gonna link you with the appropriate community-based organization to start enhanced care management. And the network lead entity will make 2 attempts per month for 2 months. If they're not able to contact the individual, we'll close the case. So it's really important just to give that individual a heads up to expect some communication. And then ECM engagement will start. Once that contact is made, that will start, and ECM is available for a year. Individuals can reapply for another year. Ideally, we want ECM to work and for individuals to move forward in their journey and reach stability. So ultimately, maybe the second year ECM is not the right fit, but additional community health worker supports is a better fit. Or like tiering, I guess graduating, maybe graduating out of ECM. So something to consider as you're thinking about working with individuals. And again, just want to say thank you to all of you, because you bridge that connection, you have those relationships, you're out there helping connect individuals and families to the services that they need. So I think from all of the managed care plans and all the partners who are working collectively to make CalAIM work, just want to offer appreciation, because you are out in the field and you're building those relationships, and you're a valuable source to make that linkage. And I think that's it on my side. Yes. Happy to also answer any questions. Yes.
I have a quick question regarding, is Kaiser the main provider for ECM and CS, or you guys are contracted with other providers?
So Kaiser Permanente is a bit unique. That's a good question. We have a hub structure. I didn't put the slide that goes into detail, but Kaiser Permanente contracts with 3 organizations that we call network lead entities. They are responsible for doing the outreach. They're responsible for holding the contracts with community-based providers who deliver ECM, CS, or CHW. They really maintain the network on behalf of Kaiser. And then they also do that linkage, right? And part of the reason for that was to make sure we had a robust provider network across the state. In Northern California, there are 2 key network providers that you would be working with: Independent Living Systems, or ILS, or Full Circle. And Full Circle really focuses on children and families. That's where their expertise is, in terms of supporting the network for providers. And then ILS, Independent Living System, is a bit broader. They support the network for community-based providers who provide ECM for all populations, all 9 populations of focus, as well as community supports, as well as community health workers. And interestingly enough, ILS also can provide ECM supports. So they're in a unique position. So if you think of it, it's like Kaiser, our network lead entities, and then our provider network. Does that help? Sorry, Stephanie. I'll turn it to Stephanie.
Okay, so we've heard a lot about referrals, the different referral forms. I had alluded to it previously, but because Sacramento is a little bit unique, we have 4 managed care plans. And in some of the other counties, they have 1, 2, and so it's a little bit more of a behemoth here within the Sacramento area. So we're really looking to streamline the process, ease the burden on providers in general when working through this. So we created a couple forms, and then Alana alluded to the fact that we also are in the works for a 3rd form, and I'll talk about that in a bit. But the first form is the ECM referral form for adults. So we created this, and we'll be sending out the resources so you'll be able to access this. But we created this in collaboration with all of the plans. And so it is a one-stop shop essentially when working through a referral. And it has on the front page here all of the preferred modes of transmission by the MCPs. And so you're able to, for a client, complete their intake and their referral through this, and then send it to the appropriate way, and then you're able to get that direct communication with the MCPs. And this is also available on our PATH SharePoint site. It's a website that really our whole collaborative utilizes, and it houses all of our resources. And so after we had sent out the ECM referral form for adults, we received feedback that said, that's great, now can we have one for children and youth, because this is gonna be different eligibility. So we said, yes, of course, we can do that. And so we really went through a system of being really intentional when creating it. Once again, going back to the plans, working with them, and creating a number of drafts that they were able to review and then customize for their specific programs. And we wanted to make sure to include specific eligibility for children and youth on this as well. So once again, we're hoping to streamline the referral process for children and youth in Sacramento County with being referred. And we're wanting to test out how this form works. And so we are doing what we call a PDSA, which is Plan, Do, Study, Act, which really means a test of change. I'll talk a little bit about that in my next slide. But we really announced this form at a learning series that we had, I want to say, almost a month ago now, focused on children and youth. And at that, we walked through the form itself. And we're gonna be testing really the utilization of it. And so at the time of that meeting, we wanted to understand referral time processes, how long it takes people to really go through the process, what is the administrative burden and whatnot. So we did that in a pre-test. We're sending out a 30-day and 60-day post-test surveys via email. I believe it's going out, Shirley, correct me if I'm wrong, this week?
This Friday at 9 a.m.
There we go. Because that will be 30 days from our last series, so we'll be testing that out. And what's really interesting with both of these referral forms is that we're working with the Sacramento County Department of Public Health, and they are really looking to digitize it within their own respective systems and metrics. And so with that, they're going to be looking to see, can they do that in-house and then send it out directly to the preferred mode of transmission, which is primarily fax with the plans. So we would do that immediately. So we'll hear more. I believe they're set to start working on that in October. And we did, like I mentioned, a poll during our children and youth session. 60% of respondents said they plan on using this form. 40% said that it's not really applicable to their work, so that might not be a population of focus they're working with. But we are really excited to learn that essentially throughout the state of California, Sacramento is really the only county that has a joint ECM referral form for children and youth. So we're really excited to be on the practice of that. And this just sort of is a visual of that test of change I was talking about. Of course, we already did the plan, we created the form and introduced it to the community and the collaborative. We're now in that do section. So asking participants to utilize the referral form, which once again we'll be sending out and is available on our SharePoint site. And then testing at the 30 and 60 day marks. And we're gonna be really tracking the referral process and times with that. Going around the circle there, then we'll be studying the staff uptake and form completion, comparing referral processing times to before we release this to current time. And then if there's any sort of feedback or updates we need to be doing, we'll do that in the little app sector right there. And this is what it looks like, very similar, of course, to the children and to the adults ECM referral form. We modeled it after that. But once again, streamlining the process and hopefully increasing utilization overall. And with that, do you have any? Yes.
What's the cutoff age for the youth form?
The youth form, I believe it's 21, yeah. I'll turn it back over to Diane.
Thank you, Stephanie. That pretty much wraps up our presentation for today. So we did just want to open it up for any questions that you all might have. We were lucky to have the managed care plans in the room with us today, and our policy
start. Yes, there is a list. And so we often get asked that question, and we do encourage sessions like this. This is why we're networking, to understand who all is in the room, who's all offering these services. And so if you know of a different provider who is offering perhaps enhanced care management and you have a close relationship with them, you can reach out and say, hey, I have this client I think who would benefit from these services, and then refer them over, and then they can walk through the process with them. As far as an actual list, that is also another resource that is available on our SharePoint site that is part of our collaborative. And it is our provider directory, where we work with the plans once again, and on a quarterly basis, they provide us a list and contact information of all their contracted providers for both ECM and community supports. And we consolidate that. We have emails, phone numbers, a list of the services they provide. And so do encourage you all to check out our SharePoint site. I believe it's in the resources. If not, I'll send it over. And do encourage you also to start attending our collaborative meetings that happen on a monthly basis. Our next one is scheduled for October 22nd, and we'll include that link as well.
So, can a client help us listed?
They can. Yes, a client could reach out. I would, and because as mentioned, there's no wrong door, and so they could refer themselves into the program. It might be easier for you to work with another provider partner, just who is used to working through the system, as opposed to someone who's not been really into the administrative work of it before. But no wrong door.
Yeah, so I have a question. So is there anyone that can go in person to meet some of the clients? Because some of them have like spotty phone coverage. Some of them just need like an in-person type of touch because they don't do well over the phone. I know I had a lot of difficulty getting someone with who is ASL speaker, getting connected to ECM because they kept wanting to do like phone calls. And even now, like I still have someone, they left her a voicemail, and I specifically let them know like this person needs an ASL person to come and use sign language. So I mean that's my question.
And yes, absolutely, that is really the role of the enhanced care manager, to go and meet with the prospective member either over the phone or in person, and that is something that they could work out directly. And I'm sure the plans have their own modes when there's specific requirements for different sorts of needs that need to be addressed.
So, two things to that. So on the referral form, there is an area where you can add additional details in terms of preferred mode of communication. You can also include or make the recommendation as the provider to be part of the initial outreach if it makes sense for you to be part of that conversation, to support that conversation. If you include it in the referral form, we'll take note of that, and that helps us, ensure that initial communication is happening to meet the member's needs. So I would suggest doing that. Ideally, yes, with ECM, those conversations and that the services should be provided in person, but I understand that with Kaiser, we do that phone call. So again, going back to the referral form, if there's any specificity or details that we need to know to make sure there's a successful connection to the individual, please include that in the notes, because that will help determine. And again, you can be part of that initial set of early conversations to bridge that connection.
I was gonna ask a question to everybody else, so go ahead. I see there's hands raised.
During two of you guys' presentation, I heard you guys mention your PWLEC and how you use PWLEC where they're at. And I was wondering, could you go into more detail about that? And is it just to meet people where they're at, or is it also used to help bridge the gap between the people where they're at and the systems?
Yeah, I mean, it's so enhanced care management. It's it's for individuals that are clinically and socially complex. So the idea is that really it's a lot of this is member driven. It's designed to be very we call it like patient centered. So if they say I want to if there's like corner that they wanna meet at, then the lead care manager would support those efforts in showing up at that corner. If they're like, you know, I actually have access to a, you know, reliable mobile phone today, you know, I just wanna, or this week, I just wanna engage over a phone. Like, so it's really kind of member directed as far as like the kind of mechanism through which they want to engage with the lead care manager. But obviously what's important with ECM is that they are engaging, and so that's a really important component, and hopefully with the relationship that they build with the lead care manager, they're able to create that rapport, which is why having individuals with lived experience is so important to really kind of facilitate that process. And then enhanced coordination of care is a key component of ECM. So really it is the lead care manager, as we always liken them to like kind of the quarterback, if you will, if you're a sports fan, or kind of the air traffic controller. So they really are supposed to be intended to, you know, they go through a full assessment with individuals to look at kind of what their social needs are, medical needs, behavioral health needs, kind of understand who's part of their current support system, who would they like to engage, and then really from that they develop this really comprehensive care plan, which you know, is member-directed goals based off of like what they're kind of seen as like what are some gaps that they need to address in order for them to, you know, kind of reach their care management goals. So so yeah, it really is, you know, supposed to be very supportive, but also a key component is helping individuals with that skill development to hopefully build that, you know, resiliency and those skills to hopefully graduate and yeah. Does that answer your question?
Thank you, it does.
Okay.
I had a question. I do housing retention based on the deposit change. So, are you guys completely scrapping deposit assistance, or you're just not, you're doing like security deposits, or, you're just not gonna do first and last month's rent?
Yeah, and so, I should be clear that change in policy came down from the Department of Healthcare Services, and so it is statewide. And so housing deposits are continuing, that benefit still continues, it's just within that benefit, the removal of first and last month's rent.
Okay.
Because that will be transitioning over to, transitional rent, come January.
So are you gonna, if, for people you're offering security deposits, are you gonna be assisting with rent for that period also, or is it gonna be separate?
So say that again?
So you said, because for someone, I work with the homeless or at risk, and so I have a lot of clients.
Yep.
So sometimes I need, we ask, say, for 30, they cover 30%, and we cover the rest of the move-in costs.
Mhm.
And so, I'm trying to figure out, sometimes we run out of money, because we have a little small,
Yeah.
and we're like, go to Cali. So, but if Cali is pulling back, I wanna know exactly what would be there if I'm gonna refer someone for that, move-in deposit, or am I gonna ask Calais, can you pay the security deposit and then we cover that first month's
Yeah.
rent, that type of thing, so I'm trying to get an idea.
Yeah,
of
great
what that
question.
is.
So security deposits are still included, different services like pest eradication or pest abatement, and other sorts of health services that you need to set up the home are still included. And I believe there's a couple others as well. It is just the removal of first and last month's rent, but everything else is included.
Like application fees
Yes,
are
yeah.
included,
Okay.
basic household items.
Yeah, so that is all still there. And so definitely encourage you to go to the Community Supports Policy Guide. It would be in volume 2. And it lists out in explicit detail everything that is included under the housing deposits benefit now.
And so I guess just to tie that all up in a nice little bow, because this, CalAIMS can be really complex. The housing deposits is exactly what Stephanie just outlined and what Alana just shared. Like, so if folks need pots and pans or a mattress, like all the security deposits, all of that is covered in the housing deposit section. First and last month rent is still available, but it's that's a second community support that the member would need. So there are two different services that you would have to have them qualify for through the CalAIM Community Support Program. Does that make sense?
Yeah, and unfortunately, it's not live until January, so
Okay.
there is a bit of a gap there.
So for place, so for, say you have a client who is looking for ECM and community supports, would you guys, would they be connected to the same provider?
So I think it's a great question, and I think that's something we probably did not touch well on today. So a member can qualify for both ECM and community support services. You can also qualify for multiple populations of focus under enhanced care management. So you could be housing insecure and have substance use disorder needs, and supports for that. So just to make that clear, and you don't have to, you can qualify for multiple, it's not just, having to only have one. And so what would happen is if a member is found eligible for enhanced care management and also needs those community supports, that case manager that has been assigned to the member would help them apply and navigate to the community supports that they need. So if they need medically tailored meals or asthma remediation or any one of those 14 community supports, that lead care manager will help them navigate that. Because there are some contracted providers that we partner with that both serve as an ECM and a CS provider, but sometimes that's not the case. It's really dependent on which provider you're working with and what the member's needs are. So if they happen to be assigned to an ECM case manager that provides community supports as well, it's kind of a one-stop shop within that organization, which is great. But if that ECM care manager does not provide those community supports that the member needs, they will work with the external partner organizations to get the member connected. Does that make sense?
Yeah.
Okay.
Yeah, I'll just, that's the reason why I was asking that, because I have had clients who had that gap between getting connected to ECM and then getting connected to community supports.
Okay.
And, but that explains kind of why, because it's like a whole nother process.
Yeah, but it's a process that the member shouldn't necessarily be navigating by themselves. So if they are connected to ECM, that case manager,
15 different community supports and different policy changes, but we hope to get that out in the next month or so, at least by the end of the year, so that you'll have that as a resource too.
So if a person is on any or these plans, does the housing advocacy have funds? Does it have to be specific family size? Person qualifying
Yes, you can have both individuals who are experiencing homelessness, families that are experiencing homelessness, children and youth that are experiencing homelessness. So it's the wide spectrum, yeah.
Back to the transitional housing, how many months of support is that? And is there like a cutoff?
for transitional rent?
Yeah.
Yeah, it's 6 months. Yeah, and you can get that within kind of one, they say kind of a lifetime. But if there are extenuating circumstances, like really unique needs where a member would need additional supports for that transitional rent piece, like that can be submitted to the plan, and the plan can, like at their discretion, potentially grant an additional period of support, but that's not necessarily the intention of the program.
The one caveat is it is subject to what we call a global cap. So for instance, there could be instances where a member that you're working with goes inpatient, is experiencing homelessness, still needs a place to recuperate, and so they go into like a medical respite recuperative care facility, and they may be there for 2 months. So the global cap is like 6 months altogether. So that what that scenario would create is like in 2 months would apply for recuperative care, and then they would get the 4 months of transitional rent kind of within that period of time.
So it wouldn't be 8 months of care. Like that's where like the policy nuance gets a little dense, unfortunately, because DHCS has made requirements where it's, if a member has to go into recuperative care for a period of time, that counts towards that transitional rent period.
There's 3 services that are considered like room and board. So that would be transitional rent, that'd be recuperative care, and short-term post-hospitalization housing. So kind of within that period of like that 12-month period, they could get it again like another year, but it's, it's 6 months. within those 3 services. So they could do all transitional rent, that's really fine. And then once that clock starts, if they need to use recruiter care or something like that, they would get it after that period. Yeah, don't want to confuse you, it's a lot, yeah.
What is usually the turnaround time for when somebody is needing transitional rent support?
So the policy has not yet gone live, and this kind of gets back to what I was saying earlier on, that we're working really closely with the county to establish a flexible housing pool. And the intention of that is really to be able to have like immediate turnaround of having those dollars available. So if a member, you know, is in need of those dollars immediately, they get a voucher, they have found a place and have signed a lease, and they need that money, we're able to turn that around like day of. That is the goal. And so, but we're still building that right now, and that's why it doesn't go live until January, because we're getting all of those pieces together to make sure that it's ready for January.
And my second follow-up is, so we work with the county, right, so Sacramento County, and so we provide a lot of like, that MHSA, flex grant gaps, and getting all the funding that we need to do. So for us, we're trying to figure out, like, how do we prepare our programs, our team for January 1st? Like, what does that look like? And so far, no one really has an answer for that yet. But we also want to be very proactive, right?
Yeah.
Any guidance?
We appreciate and hear you, because it is a theme that has come up, and like we value that our community partners are wanting to get in front of this and be ready for that January 1 go live. We're working with Transform Health next month during our PAF CPI meeting that Stephanie had mentioned. The plans are going to be doing a comprehensive walkthrough of transitional rent. And granted, I should say, because we're still building this with the county, there are certain pieces that probably won't be ironed out by 3 weeks from now. But we are going to do our best to give you the most comprehensive overview of the service and how it's going to be going live in January, if you want to join us for that. Yeah.
I have one question. I work very close with the shelters here in the county, and we see a lot of times clients, getting put in shelter, and a lot of times they don't qualify for shelter because that their level is too great. So why are the hospitals utilizing their plan?
It's probably an area of opportunity
Yes.
for education. I will say, actually, we were looking at the numbers, because Anthem is in 16 counties. The utilization numbers in Sacramento are relatively high, but probably not as high as they could or probably should be, given kind of the need that you're indicating. So I think there is a lot of opportunity for increased education with hospitals and discharging. And then, yeah, even if you're, also kind of creating those relationships with our recruiter care providers, like the shelters, that they're, you all can also indicate that this member is not appropriate to be here and maybe more appropriate for recruiter care and support those referrals.
And if because we're in this debate with the shelters, what you do, all you are going to will talk on us all at the shelters and educate them to how to recruit care so that they can tell the hospitals, hey, this client has health and there's recruiter care funds. We think that background would be a better fit.
We'd love the opportunity to talk to them.
Whatever you want to do, and we can get
Yep, yep.
excellent.
Yeah, and I guess to that point, and thank you for that, if there are any community partners that you all are working with that you think would benefit from or would like to speak with us to learn more about the Calian program, we would love that opportunity. The program is only as strong as those community connections and understanding to the program, out there. So we do these conversations like we're doing today often because we're still seeing, we're in the 3rd year of this program, and we're still seeing there's opportunity to teach people about CalAIM and these free benefits that are available for our community members. So we're happy to talk to anyone, anytime.
Because I also what's that outreach to our mental health conversation? Because they put about helping.
Yeah, and that's a good question too, and we'll come to you, I promise.
I'm sorry.
We have street medicine teams, and a street medicine program that we partner with providers in the county to go out into encampment areas and other parts of town to deliver that on-the-ground care, education, enrollment into Medi-Cal when and where possible. But you know, that's like one service that we're all kind of collectively providing, but you know, there's always good work to be done.
So I think if you want to take them to the body, what the first person to speak here, so that they can educate you
Totally.
and then they can partner and say, we were going to this encampment on Friday, can you join us?
Absolutely. Yeah, that's a great connection. Thank you for that.
Again, I'm sorry.
So I am, one of those shelters where we are getting some, referrals from, clients that are in recuperative care from the hospital, and they're only able to be there for like 90 days, and then they can't keep them longer, and then they end up over with us, and their medical needs is just a little bit more. I don't feel like they're ready right at that time, at that 90-day mark, and, what the feedback is that we thought was they have to go back through the emergency room to get an additional 90 days. And sometimes as a provider, that's very hard. You
Yeah.
get them at your date, and you have to tell them no, you don't meet the qualifications, and then just take them back. Is there anything where they can get like an extension? Is that something you guys are looking at to maybe allow them to stay inside that recuperative care a little bit longer than the 90 days, so that they will be appropriate to go into a shelter or congregate setting?
I mean, yeah, well, so now there's, you know, with, as I mentioned, this global cap, which, is related to those room and board services. So, again, a member now could potentially, you know, link into recuperative care for up to that 6-month period. Short-term post, again, and I think one of the other opportunities is, you know, if a member, short-term post-hospitalization is also seen somewhat as a step down. So in the case, you know, prior to, and the global cap went live, 1/1/2025, I was about to put us a year ahead. But also, you know, prior to that, one of the areas of opportunity was, okay, have recuperative care for 3 months, and then the individual could potentially step down to what we call short-term post-hospitalization housing. So it was trying to create this continuum, and that was like short-term post-hospitalization housing would be up to 180 days. So it was kind of supporting those efforts. Now, as I mentioned, all those room boards are going to be underneath this kind of global cap.
Well, I know we're probably going to work on this, but in regards to rental support for the 6 months, has there been thought about what the cap is in regards to what the rent amount? And I say that because a lot of our room boards, you know, they increase it like almost every year. And right now, on average, we're paying up to $950 for a shared room. And so I think in the last meeting, from what I've heard was, there's gonna be a cap that the ministry kind of gonna pay up to, and then it's like landlord incentive, kind of figuring that out. And I'm more concerned because I don't think our landlords are in the know of what the change is gonna look like, right?
It's a great question, and what the policy is, and we'll dive into this next month as well, there's a fair market rental rate, and that's, you know, either by zip code or by county, and that's what we, the plans, are going to pay out to. And then, of course, there's the nuance between, is it a single, you know, like, single person needing services, is it a family, because that will be on that scale as well in terms of determination of like what level of support we would be providing on those.
I was wondering kind of more systematically that what is like the first, how is CalAIM introduced in a client's homelessness history? Like, I don't know if there are efforts for, say, 211 to like have that be mentioned kind of earlier on, especially someone who is, you know, at risk or just has never been homeless before and is at the beginning of this journey, to kind of get a jump on that, assuming they probably have Medi-Cal already. I don't know if like Sacramento Sport or 211 might have like a thing.
I can add a little bit there, like something we began working on is
That'd be a great idea.
One is, screening for LAML eligibility, and we have a few providers that we can make direct referrals to already.
Awesome.
Yeah, they have to complete the, HCT.
Yeah,
That's
the
where it
HCT, yeah.
captures it, yeah.
Yeah, I was wondering that, like, yeah, as someone who sees like HCTs, I see that, you know, that opening says, oh, Medi-Cal and where they go, but I'm like, I don't know if it went anywhere from there.
It's dependent on which, managed care provider they have though, because we don't have access to everyone yet.
Oh, which ones do you have access to?
I can't remember off the top of my head.
It sounds like there are a lot of plans for supporting families getting permanent housing, which I think is great, but while they're in that transitional period, is there also gonna be supports available for like interim shelter? I know a lot of our families are on wait lists for shelters. Will there be opportunities for them to be placed in like hotels temporarily while we're locating?
Yeah, that's covered kind of in that transitional rent, so it supports both interim and permanent supportive housing, kind of whatever the member needs and how we show, you know, like, how can we support the member in their, journey to permanent supportive housing.
So that will be included in those 6 months. Okay. Thank you.
Any other questions?
I just have a question. Oh, go ahead. You go first.
Oh, yeah. So, I had a quick question. So, like, if a client, we frequently get clients that are like in need of like rental assistance. They're like, okay, I'm freaking out. I got a 3-day notice. I've got, eviction notice. How quickly can they get from, getting a referral to ECM community supports to getting that funding? Because I know that's something that like they very much are looking for in certain instances.
I think, so there is, there's an ability to do kind of like an emergency referral that completes the timeline, because, right, I talked about the 2 week from beginning to reach ECM, but there is a way to do it streamlined. What is the term, but isn't there another, just streamlined?
There's streamlined, and then so there is where, and I don't know what it's called. Yeah, but essentially it's like when there's an immediate need, like an emergent, need, we can streamline that where it then becomes like a 48-hour, turnaround time instead of up to, 2 weeks to get that placement, because we know that there are situations that, members need that immediate support, so we can, like, if it's flagged, we can, work quickly to turn that around.
Okay, so we should add that like in the referral, like under additional information. Okay, thank you.
Oh, I was just gonna ask, so I know, this is like a really savvy group, but, it's just come up in other conversations, one of the unique things around, as we talked about earlier, is that, folks have to be enrolled in, Medi-Cal managed care. And so kind of one of those first questions as you're kind of doing this, like, eligibility is like knowing which, do they have Medi-Cal and which managed care plan they have, because that may impact where you send the referrals. So I was just kind of curious, does that seem like a stumbling block for folks, or do you really know how to navigate people to understand, do they currently have Medi-Cal if they don't know? Because sometimes that doesn't happen. Just want to know if that's, if that's a challenge for anybody in the room, or you all kind of clearly know how to navigate that.
It was very challenging, in the beginning before we received a site where we can go into and see who their managed care provider is, because when they come into the shelters, a lot of times they don't know.
Right.
They say, yeah, we have it, but we don't know. And so we didn't really know at that point, how to find that information, but now there's a site that we just put in their information and it will let us know, who their provider is. So that's been very helpful, but it was a stumbling block probably about a year ago.
During our intake process, that's a question that we ask when we come to the medical part. Are you in assistance with either connecting with housing or housing support services? times they don't know. So we have a DHA worker on site, that she can look that information up for us to see who their provider is. Or they don't even have like the ID cards on them. So we help them get ID card and that way they know who the provider is. My question is, what if the family only has straight Medi-Cal? Would they have to sign up for a managed care provider, so it's no just how they get a provider linked to the Medi-Cal?
Yeah, so if they're currently enrolled in straight Medi-Cal, they would have to transition over to Medi-Cal managed care, and enroll with one of the 4 plans. I understand that, sometimes there's reasons that a member is enrolled in straight Medi-Cal based on what their needs are, and the services that they get under straight Medi-Cal. So that's, kind of an assessment that would need to be made, on a case-by-case basis. And if the programs that member is, if they're not enrolled in any special programs that are offered through Medi-Cal fee-for-service, straight Medi-Cal, then it might make sense for them to transition over to managed care. But it's really kind of a case-by-case assessment.
I'd like to follow up on that. What if you have a child who is from a different county, that was adopted, and that county holds their Medi-Cal rights, and they're not assigned to an MCP?
Well, CalAIM is, that's a really great question. CalAIM's offered in all counties across the state. So there's that, so that the child could still qualify for services if they're enrolled in a managed care plan, say in Hampton County. And I think I probably wanna follow up with this, cause I don't wanna misguide you, but I think that we're able to kind of crosswalk those services and have the billing that's where it gets like nuanced and complex. Can we follow up with you via email on that? Because I wanna make sure that I'm not misspeaking, and because there's a lot of nuance there, unless you know offhand. No?
I mean, to get the services, like, here, they would have to change to this county. However, and they have straight fee-for-service, or they just have their Medi-Cal managed care in another.
So they're just straight Medi-Cal.
They're straight Medi-Cal,
But they
okay.
live in Sacramento, but their county won't, it's like, you don't have to sign to an MCP, your adopted child, we got your benefits, don't worry about it. But then when you come here, trying to link them to CS or ECM, it doesn't work, because they're not tied to anybody.
Right, yeah. This comes up a lot with the child welfare population of focus. There is, work being done to get people, to get those kids connected to, Medi-Cal managed care. I know there's a lot of efforts that we're doing and working, with the county here on those efforts. I know in some counties that are what they call like coast counties, so Alameda or, Contra Costa, they've really been opting those kids into, Medi-Cal managed care as opposed to the fee-for-service, really open them up to these, services that are available.
Yeah, it was similar, cause, we get a lot of former foster youth, and they're all straight Medi-Cal, and so it's hard. And then they were like, which plan should I pick? If I pick a plan, and I have no idea, so, just now I know how to explain how to get the additional services, because it's just, if they were in the system, they come straight Medi-Cal. It would be great if you guys could open like a little spot for them, that would be great.
Yep. That's a great question, though. Thanks for raising that up. So we'll email you about it.
I think that wraps us up then, if there aren't any other questions. So I did have a few resources that I wanted to share. I know Stephanie touched on the housing deposit cheat sheet earlier. There is also one for housing tenancy and sustaining services. And again, these sheets were created with this information some more resources that we touched on today, but I do really want to point to joining the Sacramento Path Collaborative. You do have to join from the Department of Healthcare Services. You will have access to those monthly meetings that Stephanie was sharing. There's like a wealth of information at those meetings, and access to their SharePoint site, which has a lot of great resources, like that provider directory that was referenced earlier. I use that quite often. It's a great resource to have because it lists all the enhanced care management and community supports providers here in Sacramento and the managed care plans that they're contracted with. So yes, I really want to point there, and then just some other providers. And here is our contact information.
Are these all gonna be shared with us?
Yes,
Okay,
yeah, I'll
perfect.
share it to Lisa so we can share it. And then I do also want to plug that we'll be sharing this information again virtually next week. If you receive the FLC email, you should have received like the email from Sacramento Forward with the registration link. So if you have like any other staff you would like to point to joining or if you want to join again, that's in there also.
Well, thank you.
Referrals, so I just want to emphasize to everyone, please get your housing conversation tools completed. If you already have a housing conversation tool completed with your clients, just toggle something like trash bags or something so that it can update. So when we bring new programs on, if you did an old one, it won't show the eligibility for that new program and your client may not show up on that priority list. So keeping that in mind, if you connect with any of your clients the next week, just toggle it.
Should we wait 1 week and then toggle?
Yes,
Thank
I love
you.
that. Yes, definitely do that. Wait about a week, and then, but also HMIS tells you this every time. So when they're like, "Hey, do this thing," just do it. Just listen to them, you know. So making sure you do that. So the first ones are going to be New Sequoia Hotel. This is a HCD program, so it's a hotel refurbished program. There are going to be about 118 units coming on. However, it is shared housing. So what it's going to be is that it's going to be a single room occupancy. So it's just like a hotel. And then they're going to share, they're going to have like shared bathroom and kitchen space and living space. And so communal spaces. And then there's also going to be Madison Square, which is also a refurbished hotel that's going to be off of Madison up there in North Highlands. So that's about 70 units. And those are also going to be with some behavioral health units as well. So again, emphasizing to y'all, get connected to your behavioral health services if you can. So going to your cores, going to going to BACS, all of those are helpful. Then we do have some PSH programs, which are the ones that you have to be chronically homeless and have a disability in the household. So keeping these in mind. The cool part about these ones is that they're more so for families.
Oh.
So they're going to be one. So one is going to be at 440 Arden Way. This is going to have 1 bedrooms, 2 bedrooms, and 3 bedrooms available. Again, clients must have all their documents in HMIS, have the housing conversation tool so that they can get on the priority list. And we're going from most vulnerable to least vulnerable. And then lastly, Step Up on Second is going to have some tenant-based rental assistance. So just like the SHRA Section 8 program, their housing choice voucher, instead it's through the federal government. And these are going to be coming available too. So these are going to be, they can go through a private landlord and they'll pay for this subsidy. And so this is going to be both for singles and families. So keeping that in mind. So yeah, these are some really great programs that are going to be coming on. SSF is going to be making referrals for them within the next month. I just want to give y'all a heads up now so that you're making sure your clients are document ready and making sure that they have their HCTs and that you're updating the HCT if they already did one. So no one gets missed. Right?
Quick question.
If you have any questions.
Sorry, go ahead.
All right, cool. If you ever have any questions or you're unsure about what document readiness is or where your client lands on the priority list, you can always show up to our CAS office hours on Mondays from 2:30 to 3:30. It is a Zoom link, so simply hop on, put your client's UID in the chat, and then we can tell you where they land on the priority list and what level of document readiness they are.
Is that Zoom link on our website?
Yeah. If not, reach out to referrals@sacstepsforward.org and I'll send you the link. Yes.
for the step up one, are they gonna prioritize the people in the motel program first?
Nope.
Nope, it's just gonna go live?
It's gonna go through our regular priority list.
Okay.
Yeah.
And then for the, how many for the PSH families?
So for the, what is it called? For the tenant-based rental assistance, they're gonna take on about 15 families. And then for the 440, let's see, I'm trying to do the math in my head. I wanna say there are gonna be another 20 units at the 440 Arden Way. And then the other, so the Madison, so the new Sequoia and the Madison are gonna be singles only. So I guess that's also the part too. Having conversations with your clients and being open to what living, like having your own room, but having to have shared spaces, like being open to like this is what's in our system now. And as always, we do allow client choice. So we always offer to the provider to talk about it with the client, and they can choose to move on with it or not.
And medicine was, you said it was more behavioral health.
It's both. So we're pulling it from both our CAS community, and behavioral health does have some units there as well. So if your client happens to be around both, that does increase your chances of getting into them.
And that's for singles?
Yes, singles only.
So
And I
medicine
think-
is also shared? I'm sorry.
No, you're fine.
Yeah.
So the Sequoia and the Madison are both shared. And in the newsletter that's gonna be sent out next month, it'll have all this information for you. So I'm just throwing it at you right now. Please tell people, get the word out, and then there'll also be an email blast next month.
Awesome.
That's good news.
Yeah, of course.
I have lots of singles.
Rule 211.
So that's the part. So the housing part is that you need to be connected to a housing navigator. So 211 is just an access point. 211 is just there to kind of help you, like if a client, they're not connected, they can get an HCT done, they can get a crisis assessment done, they can do some housing prevention. But when it comes to housing, they need to be connected to a housing navigator, because this is the person that's going to do the ongoing services, doing the applications, turning in documents. A lot of our work isn't through the client ever. All of our work is through the provider. So it is heavily, not implied, it is explicit that the client be connected to a provider who's gonna work with them from start to finish, right? Who's gonna help them get Pallium supports or community service support, community supports, all of that, and be a reliable phone number. So when SHRA is like, hey, I'm missing this document, or I need this correction, it can be done as quickly as possible. And always, with these programs, we over-refer, right? So the folks who get approved both by property and SHRA first are the ones who get the unit. They're guaranteed the unit. If they're only halfway through their application because the provider isn't with them anymore, or they aren't in contact with their provider, right? We have to keep moving on. We have to fill these units. Okay. All right, so again, referrals at sacstepsforward.org if you have any questions, and then this will be in the newsletter.
Thank you so much.
Or any other agency that wants to do a shout out or share resources.
Hi, so I'm an ECM provider. I came here to connect with referrals for a CS provider. If you're a CS provider, can I take your information? If anybody is.
We'll have to let us
Yeah.
what happens.
Okay, thank you.
Yeah.
I'm with Vinca as well, but we're the ECM. If you have questions, want to learn more about it, currently we are with Kaiser and HealthNet and Molina. I'm more than happy to talk to your team about what we do and what we offer.
And how else helping you do your presentation next month? I heard that you were so excited to share.
Can I have a
It
card?
can be a short.
I'll talk to you.
Can we get a card?
Vinca.
V-I-N-C-A.
I have cards. I'm fairly new, so if you see my manager's information on there, I'm Christina. I wrote in Christina.
Christina, can we get some?
Yes, I was just going to get you because you're in El Grove. I'm going there.
Oh, yeah.
Yes. So,
Let me get one more. Thank you. Yes.
Oh, I already got you.
Yeah. I gave it to her. Yeah.